are trending upwards a little bit, so that's really what's keeping us from moving to green from yellow. But overall, I'm very proud of where we are, and I think today's is a day to really celebrate. The other piece of unique news, important news that we got done today at Commissioners Court is an item on worker safety. You hear and you see the sights and the sounds of construction all throughout Harris County, whether it is our detention basins, our widening of our channels, flood control work, or simply constructing new roads, new buildings. That's going on all the time. Some studies say up to 1 in 7 workers, construction workers, get hurt on the job. And so in Harris County, we have over the past 2.5 years taken initiatives to try and keep construction workers safer. Today, we committed $1 million so that we can provide training, OSHA training, to all construction workers in Harris County. And what happens is there are safety standards, but oftentimes the contractors do not have the funding, are simply, there's just no way to enforce for them to actually provide the training. So we're saying the county is going to provide it, and that way all of the workers and the folks, even that works for contractors, can get appropriately trained, and that way we can reduce the risk of injury among the folks, the incredible folks that build this county. So anything else?
Yeah, you had 2 items on the agenda about the GLO situation. Where do we stand with that as far as trying to get additional funds from the state?
What we know is that Harris County and the city of Houston were the hardest hit areas from Hurricane Harvey. We had the most deaths, we had the most structures flooded, over half of all the deaths from Harvey and over half of all the structures impacted were here in Harris County, and so we deserve an adequate amount of funding for flood resilience. The GLO committed $750 million to Harris County after initially having awarded us 0. Now, that's a big step, and I've spoken to Commissioner Bush about that. Now, the next step is we need to make sure that the federal government, HUD, approves that. That's number 1. And number 2, we need to make sure that the city of Houston also receives a share of the funding. Of course, Harris County wants to compete for even more of those funds. We believe we deserve at least $1 billion, but $750 million is a good start. I simply want to ensure, and I've been in touch with the mayor on this, that we say, okay, that's a good start, but the city of Houston needs its $1 billion. We were expecting and deserve $1 billion, and we just need to continue working with Mayor Turner, with the GLO, and with HUD on all of this.
What concerns you most right now about the COVID situation in Harris County?
Right now, the one concern, and I do want to put this into context. I mean, we're doing so much better. Our hospitalization trends are going down. Our percentage of patients in the ICU who are COVID positive are going down. Our positivity rate is going down. The concern is that amongst the unvaccinated population, that folks will stop taking the precautions they need to take, and they will continue to spread the virus. The other concern, and this is perhaps the most significant, is the wanting to make sure people continue to get vaccinated. 55% of the vaccine-eligible population having received at least 1 shot, that's big progress. But we still have a ways to go to where we can say, okay, we've beat this virus. So to that end, today we approved an agreement for an all-out, what we're calling a ground assault, a ground war against this virus, where we're going to be sending a lot more resources into communities to do door knocking, to send information, help people understand how to get vaccinated, the importance of vaccination all throughout Harris County. That's on top of the work we've been doing with a media campaign, with mobile vaccination sites, with free transportation to our massive NRG site, with incentives for folks who get vaccinated. So I just want to make sure folks keep in mind 2 things. First, get vaccinated, and second, if you're not yet vaccinated, remember that you're not immune to the virus. And so we don't want you spreading that virus amongst you and other folks who are also not vaccinated, and we need you to take precautions until you receive the vaccine.
One of the bills that the legislature passed right at the end of the session was a ban on homeless encampments. obviously this was something that was aimed in large part at Austin, but it's going to affect Houston, it's going to affect Harris County. How is the county planning on enforcing this?
We're looking into that. Obviously, we're still trying to see, what all is going to be signed by the governor, understand the legal implications of the bills that do become law, and then based on that, we'll take our policy considerations. But I'll say the city of Houston and Harris County have made enormous steps to tackle homelessness. Just this past year, we invested over $50 billion in a joint program to help folks experiencing homelessness find permanent housing, and we're right now evaluating that program, trying to see what worked, what didn't, and really, apply a paradigm shift in the sense of how do we tackle homelessness and really be evidence-based and smart, and I think that involves using, smart tools, not blunt tools, but we'll just have to see what the legal implications of the governor's or of the legislative bill is. Ok, en español, bueno, el día de hoy es un día para celebrar. Nos reunimos aquí en la Corte de Comisionados en persona por primera vez desde que empezó el COVID, y esto es dado a los números que siguen mejorando día tras día. Todavía nos falta un poco de progreso, los casos están subiendo, pero en general todo se ve muy bien. Más del 55% de las personas mayores de 12 años en el condado Harris han recibido al menos una vacuna. Más del 44% tienen ambas vacunas. Entonces, es celebrar que esta comunidad ha logrado pasar lo más difícil del virus, y de aquí en adelante toca seguirnos vacunando. También pasamos una política pública para proteger a nuestros trabajadores de construcción. A través de todo el condado usted ve muchísima construcción, trabajos de control de inundaciones, carreteras, vías, edificios nuevos, muchos proyectos del condado. Normalmente no hay manera de requerir que los contratistas hagan entrenamiento de seguridad, de buenas prácticas. Entonces, para los proyectos del condado, ahora hemos comprometido $1 millón para nosotros ofrecer ese entrenamiento a todos, esa capacitación a los trabajadores de construcción, sus supervisores, para así mejorar la seguridad, proteger a nuestros trabajadores de construcción que no sufran accidentes ocupacionales.
Había dos cosas sobre asistencia con renta. ¿Cómo vamos con eso?
Hemos tanto el condado Harris como la ciudad de Houston hemos invertido casi $300 millones en apoyar a los inquilinos, también como a los propietarios, desde que empezó la pandemia. El día de hoy invertimos otros $24 millones para apoyar tanto igual a los inquilinos y a los propietarios, para seguir impulsando el progreso ahora que estamos de salida después de los impactos del virus.
Para la gente que no sabe, ¿dónde pueden buscar esta asistencia?
Esa información se las daremos directamente a usted. Lo estamos administrando a través de organizaciones sin ánimo de lucro, Baker Ripley, Catholic Charities, que tienen los contactos con la comunidad. Entonces, ahorita Melissa le da la información. Okay.
Right here.
Yeah.
How long do you think it'll take for us to reach Biden's goal of 70% vaccinations?
Oh, that's up to the community entirely, whether we reach our goal of 70% vaccination. And look, we're doing so well. We're seeing our young people get vaccinated more than ever, but that's where, all of us have a hand in that. So if you have the vaccine, tell your friends, your family, your colleagues. You are the most influential person when it comes to getting the rest of your network vaccinated. And if you don't have your vaccine yet, please go ahead and get it. If you get it with Harris County Public Health, you get it for your child. They are now eligible for a scholarship to college or community college in the state of Texas. If you get it for yourself at a Harris County Public Health site, you're in the running for all kinds of gift cards and free tickets. I mean, there's no reason not to do it, and the vaccine's been proven to be safe and effective, so we really need folks to make sure they take that step.
How do you think we can further incentivize people getting those vaccinations?
You know, one is the help from each member of the community spreading the word. There's been limited research on how you persuade folks to get the vaccine, but what is out there shows word of mouth is number one. We can do all we can as government, but individuals are the most impactful. And then, of course, you know, we just committed to a massive door knocking and texting initiative to go to the hardest hit communities, as well as a continuation of our incentive programs through our gift cards, through our ticket giveaways, our scholarship programs. We're going to continue to see what else. You know, we had a discussion about what more we might be able to do.
And what do you think right now is the greatest obstacle to that end?
The obstacle to vaccines, a lot of it is simply misinformation. I know there's vaccine hesitancy out there, and so that's where, you know, the folks that can help us really battle those myths are the folks that have had the vaccine, that know it's safe and effective and it protects you against the virus. That's how we tackle that misinformation. That's why we also have a media campaign that explains, you know, how safe the vaccines are. But of course, access is always an obstacle. So we now have up to 40 roving units. We've been to over 200 locations, close to 250 locations throughout the county. We've been to 40 schools. We have 50 more schools that are scheduled. We're all over the place, taking the vaccines to where people are at. If somebody needs a vaccine, doesn't have a ride, we'll go pick you up. So, you know, just call the public health number is 832-927-8787. All right, thank you.
Thank you.
Take care.